Hi, I'm Dr. Katey Nicolai, and I'm back to answer more of your questions about mental health today. So the first question that I have on my list, how can I overcome self-doubt? So that's a really big topic. Self-doubt can come from a lot of different places. It can be a momentary lapse in your confidence due to something difficult happening at work and school, or it could be kind of a more long-standing issue. Maybe you've always been someone who struggled with self-confidence, maybe because of the family that you grew up in, or maybe you're struggling with a mental health diagnosis right now, like depression or anxiety, and that involves patterns of thinking that cause you to question yourself and think negatively. So the first question that I have is to really do a little bit of self-assessment. Is your self-doubt pervasive, or is this a temporary situational self-doubt that will resolve in time? If it's more pervasive, ask yourself, is this having an impact on my functioning in relationships? Is this something that's preventing me from achieving things at work, from reaching out and making connections to people because I have this kind of negative track running in my mind all the time? And if that's the case, I think allowing yourself to take that first step and get into therapy to open up to someone about this and find tools that apply specifically to you is a really good place to start. Often it doesn't take as long as people fear in therapy for them to come up with some more practical tools to use in their day-to-day. It may only take a couple of weeks for you to start to change your pattern of thinking and start to develop more positive and easier perspectives on life. So my first recommendation is to do a little bit of self-assessment on how pervasive the self-doubt is, to take that step toward therapy. But one small trick that you could try practicing day to day, instead of aiming for all positive or all negative thinking all the time, try to aim for more balanced thinking. So if you notice yourself being self-critical in a moment, rather than trying to flip that all the way into all positive thinking, ask yourself, how could I make this thought more balanced? So one possible outcome in this situation is that I fail and everyone judges me. But a more balanced perspective is that there's a chance I could do well. And so how can I try to balance some of the negative thinking with some more positive thinking and try to at least split it 50-50 to begin with? So start with a smaller approach toward overcoming that self-doubt and grant yourself a little bit of grace as you work toward it. The next question that I have on my list, what tricks are there for loving yourself more? And I love the way this question was asked. I think that, again, this might be something that you decide to talk about in counseling. Having a healthy and positive relationship with yourself is really essential for all healthy relationships. We've all heard that cliche before, but this can be something that we struggle with for a variety of reasons. Maybe this is maybe you grew up in a family that didn't lend itself toward healthy relationships. Maybe your relationships have been strained with your family over time. Or maybe you're struggling with a mental health diagnosis that involves a lot of negative and self-critical thinking, like I mentioned earlier. One trick that you could try day to day is trying to speak to yourself in a kinder way, the same way that you would speak to a friend. So when you catch yourself thinking negatively, pause and ask yourself, would I speak to a friend this way? Most of the time the answer is no, because a lot of our internal monologue can be a lot more negative and biting when it's inside, away from everyone's viewing eyes. So instead, think, if my friend was facing the same problem or the same dilemma, or my friend made a similar mistake, what advice would I give them? What approach would I take? And then try to note the differences in the way that you talk to yourself and the way that you talk to a friend. And over time, try to take small steps toward being more loving to yourself, treating yourself as your own friend. If this seems daunting, it's because it can be hard to accomplish this on your own, which is why I always advocate for reaching out to a therapist to help you with practical steps along the way. But starting to talk to yourself more like a friend is one quick trick for working on loving yourself more day to day. The next question that I have, how can I conquer body dysmorphia? This is a fairly specific diagnosis, but I can broaden this out to include anyone who's struggling with negative feelings about themselves, their body, maybe having to do with their appearance. So this could include struggles with disordered eating, struggles with the way we perceive our bodies to be and the way we think others are perceiving our bodies. But we can also even broaden this out to struggles with self-confidence in general and worrying about other people judging us. So how can I overcome this? That was the question. Usually, it's best to find a therapist that can help you with these specific concerns, because they will be able to get to know the true nature of the symptoms and struggles that you're having and give you personalized recommendations for how to overcome these symptoms. But I think similar to the solutions that I presented above, often the journey towards more self-acceptance, whether it has to do with food, body, or general self-confidence, is a lot more than just waking up overnight and suddenly finding that you've struck inspiration and you suddenly love yourself again. Similar to other changes, it takes time, it takes commitment, and it usually takes much smaller steps in the beginning than you realize. Even making one small shift, like beginning to notice the way that you speak to yourself on a day-to-day basis, can be the impetus for small change over time. So if you're struggling with a diagnosis like body dysmorphia, I really recommend you get some professional help with that. But one thing that your therapist is likely going to work with you on is setting small, manageable goals week to week that help to change your thinking over time. So start slow, but commit, and reach out to therapy if you can. The final question that I have: how do I know when I need therapy? Which is kind of the overarching theme of all of the questions today. I think anyone can use therapy, but one good tool or one good rule of thumb to review, how do I know when therapy might be necessary for me, as opposed to just a good tool for anyone to have, is when you notice that the problems that you're having day to day are getting in the way of accomplishing things like going to work effectively, getting good sleep at night, or maybe your relationships are starting to suffer. You're having trouble connecting to other people, or other people are noticing that you've changed. These can all be good indicators that it's time to get some assistance with some therapy. I think there's been a lot in social media lately that's working to destigmatize mental health and helping folks to understand that 20% of people is a big group of people, and really there's a much higher percentage of folks who could benefit from therapy at any given moment. And so why not reach out? Why not receive support and help and connection when you can? So how do I know when I need therapy? I think the answer is always yes, but how do I know when it's the right moment for me? It's when life is starting to be a struggle and it's the right moment for you to ask for help and connect to somebody. So I just want to thank you all for submitting your questions. I'm so happy that I got to spend a little time with you, and I look forward to connecting again.